Um, Dear panelists, you've heard a lot today. You've heard from 3 government health agencies. You've heard from IOM selected stakeholders. You've heard that there's a huge groundswell against this study, and you've heard why that is so. What can you do? You can assess the situation as scientists and physicians. Dr. Nancy Lee is on record stating that Secretary Sebelius told her a case definition is a clinical decision that has to come from the clinical community, not the federal government. Yet you have just heard from 3 representatives of the federal government, and you have been told to coordinate and work with this study sponsor, the NIH, through its Pathways to Prevention program. This is in direct violation of IOM's written study process and presents a blatant conflict of interest. How is this an independent and objective process? How is this about science and medicine? If you think your task order isn't politically motivated, consider that the CDC has been well aware of the scientifically sound and expert-driven Canadian consensus criteria for over a decade, yet refuses to take down its own diagnostic and treatment guidelines, the harmful and misleading CFS toolkit. That's right, it's based on science, Your task to develop clinical diagnostic criteria for ME and CFS has already been accomplished. 2 primers. Okay, specifically aimed at clinicians unfamiliar with these diseases are available. Both are based on criteria developed by disease experts and published in peer-reviewed medical journals. Both are available as you can see, easy to distribute pamphlets. I'm referring to the overview of the Canadian consensus criteria and the ME-ICC primer for medical practitioners. The latter is an update of the former to reflect scientific developments through 2011. That's right, it's based on science, not politics, and the combined knowledge of experts who collectively have diagnosed and or treated more than 50,000 patients with ME, have more than 500 years of clinical experience, have approximately 500 years of teaching experience, and have authored hundreds of peer-reviewed medical publications. You cannot do better. Some of you are new to this disease. How would you feel if non-experts decided to diagnose heart failure or lymphoma or lupus? If you truly want to fulfill your task, all you need to do is read, share, and distribute these pamphlets. Both are available from the UK charity Invest in ME. They have a website, and also can be downloaded from a number of websites. Both can and should be distributed. That is the end goal of this study. Each one of you is in a unique position to do just that. Order these guidelines, print them out, or at least share the website URLs with your networks. Use your positions to get these documents out to primary care practitioners. Tomorrow, tell the IOM to stop this needless study. Defer to the collective judgment of your eminently qualified colleagues and do your part to get the CCC officially adopted. Resign from this panel. To do otherwise is to harm patient care and impede research. Thank you.
Well, I appreciate all the people who have spoken with us today. I think that we have certainly heard what you have said. And I know that many of you come at no small cost to yourselves. And for that, I can speak on behalf of the committee and say that we are truly grateful for your efforts. So with that, I will close this session. The committee will adjourn upstairs, and I wish all of you safe travels. Thank you very much.